Amazon infiltrating so many aspects of American life, and one area the tech giant is pushing into further is healthcare. Our own Anjali Kamlani sat down with Amazon Health Services Senior Vice President Neil Lindsay at the health conference earlier this week, and she first asked him about the progress the company is making now after struggling previously in the space.
At Amazon, we're always trying to invent to make customers' lives easier, right? Our mission is to be Earth's most customer-obsessed company. So that gives us permission to go anywhere if there's an experience that needs improving. And as we all know, unfortunately, there's plenty of opportunity in healthcare to improve the experience. So we've had various ideas at different points in time, and we learn from all of them. And our focus is very much on how do we make it easier for customers and patients to find, choose, afford, and engage with all of the products, services, and professionals they need to get and stay healthy. That's a pretty big mission. But we are very focused on how we make it easy to get care, how we make it easy to get medications, and ultimately how do we make it easy for you to find the things you need to get and stay well. And so that's our mission, and we have a few efforts going on in that place, as you mentioned. We have One Medical, we have Amazon Pharmacy. We also have a service called Amazon Clinic. So when we think about making it easy to get care, we think about it in two different need states. Mm-hmm. There's the 40% of people who don't actually have a primary care physician but still need to get care, and it can take 2 or 3 weeks, or sometimes 3 or 4 weeks to get an appointment with a doctor. So Amazon Clinic tries to make that much easier for common conditions, low acuity conditions, for people to be able to access from a selection of providers, either do text or video to either validate what they think they might have or to correct it and then get a treatment. They can send that treatment, if it's a medication, to any pharmacy, including Amazon Pharmacy. And then, of course, we want to make sure it's easier for people to get the primary care we all deserve and need, frankly, that care management for ongoing needs. And that's why we have One Medical, which we're excited to make available to more and more people. And then, of course, I mentioned making it easy to get medications, and that's Amazon Pharmacy.
And you're growing that, right, from what I understand?
We're in this to make it easier for customers, and to make it easier for customers, we're going to make it more accessible, and that means growing it also.
I'm so glad you used the word low acuity, because that's a really important way to describe what is going on in this retail big box medicine space, right? There is a lot of need for more access points, like you said, really getting to the customer where they're at, making it convenient for them to schedule an appointment. That's the goal. As a millennial, I can totally appreciate that. But talk to me about how that affects the broader health ecosystem, and whether or not conversations are happening where you think about how does that affect tertiary care and the infrastructure they need to kind of stay afloat with charity care and the like. There's a lot that goes on in the health ecosystem. How do you disrupt it but not destroy it?
Well, our mission is not to disrupt anything. We don't go into anything with the idea that that's a goal. Our goal is
You should tell everyone that, because they're all convinced you're going to disrupt it.
Well, we don't have a magic wand. What we do is we look at what are the experiences that need to be improved that we can make a difference in. And what we're good at is connecting the dots between people as customers and humans to the products and services they need. You do that in a general sense, and in healthcare the need is the same, right? We need to connect the dots. Remembering also that 60% of everything we sell on Amazon is sold by a third party. Right. So we don't need to do it all ourselves. We'll do things first party where we believe we can elevate the experience. So Amazon Pharmacy, One Medical, we believe are elevated experiences where we can take our expertise and make a difference. When we in Amazon, we often talk about selection, value, and convenience as key to making things easier. In healthcare, I've translated that to sort of choice, convenience, and continuity of care. That choice is important because it gives customers agency. One of the things that in a retail environment, customers do have agency. They have informed choice. Patients don't always feel like they have agency. They don't feel like they have choice. So we need to give them choice. Secondly is convenience. Convenience is key because if it's easy, people will engage. If they engage, they'll get better health outcomes. If they don't, they won't. And the problem is it's hard to engage right now. If it takes 3 or 4 weeks to get an appointment, if you have to line up with 15 other people who are not feeling well at a pharmacy and wait 20 minutes to get your medications, it's not easy. People aren't going to do it. They're just going to not get well. Right. And it's costing us a fortune as an economy. So, and then the final point is continuity of care. Ultimately, we all need and deserve that continuity of care that a service like One Medical provides. But to be clear, we're excited by wherever anyone gets their care. There is so much need in healthcare to make it easier that we're working hard to do it in whatever way we can, and I celebrate anyone else who's making a difference in making it easier.
So final question for you, on the pharmacy side, you have a lot of partners that are willing to come the automatic coupons, for example. I know that was a really great idea. But then what about the idea of breaking open that whole system of getting access to medicine, breaking apart the PBM system, getting the drug manufacturers to sell directly on Amazon? Can that happen?
Yeah. Well, look, I think one day at a time here, right? And, our whole mission, as I said, is, I think of it this way: if we can make one little thing a bit easier for a lot of people, it'll save them a lot of time, a lot of money, and probably some lives. If we can stack up a few more of those, it'll save a lot more people, more money, more time, and more lives. And over time, you stack up to what is, feels like a reinvention. And if you think about Amazon more generally, that's kind of what's happened, right? If our 25 plus year history, there's not one moment where it was like there was this magical thing and it all changed. It's over time we've stacked up these innovations, some of them small, some of them larger, to make life a lot easier and a lot better. And that's all we're trying to do in healthcare. So, I'm focused more on what can we do next week, next month, and next year to make a difference for customers and patients and members and make their lives better.
Slowly but surely, those building blocks and learning the system all at one time, right?
That's right. Well, I guess so too. Yeah, we have a lot of healthcare expertise in our team, but it's new to us as Amazon, and we know that. We know that we have to come with this with a lot of humility and learn from a lot of folks, and learn from our own experiments as well. But there's a lot of opportunity to make a difference in people's lives, and we're excited to be doing it.
We'll have to leave it there. Neil Lindsay.
Thank you very much.
SVP of Amazon Health Services.
Great.
Thank you for joining
Great to
us.
be with you.